One of the things that can certainly make your pregnancy high risk is diabetes mellitus. People call it just diabetes. Now, diabetes really in pregnancy comes in three flavors, so to speak. There's gestational diabetes, type 2 diabetes, and type 1 diabetes. Gestational diabetes is sort of its own thing, and so I'm going to cover that in a separate video. But let's talk about type 1 diabetes and type 2 diabetes. First of all, these types of diabetes are pre-existing. In other words, people have this before they get pregnant. Pregnancy doesn't make type 1 diabetes or type 2 diabetes show up. It's something that's already there. Now, occasionally you may not know about it until you become pregnant, but it was there. Otherwise, it's gestational diabetes, which is our other video. Type 2 diabetes and type 1 diabetes are very different diseases. Type 1 diabetes is actually a problem with the pancreas that doesn't make insulin. Type 2 diabetes is actually a problem with receptors that don't see the insulin. So for type 2 diabetes, you make plenty of insulin, your body just isn't able to use it correctly. Whereas type 1 diabetes, the problem is that your body's not able to make insulin. Both of them end up giving you higher blood sugars, which is why they have the same name, but they really look very differently. So for type 1 diabetes, people tend to get that when they're young. They call it juvenile onset diabetes. So usually when you're a kid or a teenager is when you develop type 1 diabetes. Type 1 diabetics tend to be thin, and they tend to get something called diabetic ketoacidosis, or DKA, which really is life-threatening and tends to put them in the hospital. Very rare to meet somebody who's a type 1 diabetes who's never had to be hospitalized for their diabetes. So type 1 diabetics tend to be thin, they tend to be really sick at times, and they tend to get it when they're young. Those types of diabetics have to be treated with insulin. Fortunately, that's the rarest type of diabetes. Type 2 diabetes is much more common, and type 2 diabetes is a problem with the body's ability to use the insulin that the body is making. That tends to show up more as an adult. That's what they used to call it, adult onset diabetes. People tend to be heavy. It usually afflicts overweight people more than underweight people. And they tend not to have to get hospitalized for their disease. Type 2 diabetes can often be treated with diet, sometimes with medications, and sometimes with insulin. Now, in pregnancy, type 2 diabetics usually need insulin to control their blood sugars. And so if you're a type 1 or type 2 diabetic, you've already been dealing with your blood sugars and you have some concept of your disease. But things change drastically when you're pregnant. And the reason is that the baby is not going to be able to tolerate the high blood sugars that you could normally get away with and tolerate. So if your blood sugars get too high, it can actually cause a stillbirth or kill the baby. And so you have to be very careful with diabetes to manage your blood sugars very, very closely. Also, even if they're not so high that they're going to cause some catastrophe for the baby, blood sugars that are high consistently throughout your pregnancy can give the baby certain birth defects, particularly with the heart. And so you want to manage your blood sugars much more tightly when you're pregnant than when you're not pregnant. Also, if your blood sugars are consistently high, the baby's going to get too big because you're basically overfeeding the baby with too much sugar, and that can cause injury at birth or other complications. So it's very, very important to control your blood sugars really tightly in pregnancy when you're diabetic, much more tightly than you would if you weren't pregnant. That's why even with type 2 diabetes, people usually end up on insulin while they're pregnant. The medications that are used when you're not pregnant are generally safe in pregnancy as well. They just usually don't work enough. Diet is still the key. So there's not enough insulin in the world to get your blood sugars where it needs to be if you don't follow your diet. And a diabetic diet is a very restrictive diet in which you want to decrease your carbohydrate intake. Now, carbohydrates, the easy things that people know are the sweet stuff, like desserts and sugars and sweet things. But carbohydrates also are all the starchy food, like breads, potatoes, rice, corn. Those kind of things are considered carbohydrates too, because as soon as you eat them, the stomach breaks them down into sugars, and so your body, when you eat a piece of bread, what your body ends up seeing is sugar. And so those are the things that you want to decrease from your diet, and mostly you want to eat more meats and vegetables. So diabetes is a definitely risk factor for pregnancy. It has the potential for causing a lot of problems. However, it's very treatable, but it's going to be a lot of work on your part. So if you're good about managing your diet, watching your blood sugars, and keeping them under control, there's no reason that you can't have a normal, healthy baby.
Medtwice.com